you for the opportunity to highlight our paper explaining the top advances in small cell lung cancer in 2024. With small cell lung cancer, we know that was deemed a recalcitrant malignancy of the lung, really because of highlighting the refractoriness and relapse that is often common with small cell lung cancer. With small cell lung cancer, we know that there is initial chemosensitivity, but unfortunately relapse is common. Regimens have been limited for small cell lung cancer historically until the last several years, where we've seen exciting breakthroughs. Here we highlight the exciting results of ADRIATIC, which it looks at the role of consolidation durvalumab for patients who have completed chemoradiation concurrently for limited stage small cell lung cancer. This was a phase 3 international study with standard of care placebo compared to the role of consolidated durvalumab and a third arm with durvalumab and tremelimumab that has not been unblinded. The results were reported at ASCO plenary session in 2024, noting the unprecedented improvement in survival by 22 months and a doubling of progression-free survival. We noted that patients who had prior prophylactic cranial radiation or did not both receive benefit. Patients who had carboplatin appeared to have a higher signal of response and durability for patients who received carboplatin, really challenging the dogma of cisplatin in this patient subset. ADRIATIC represents a huge breakthrough in the last 4 decades for patients with limited stage small cell lung cancer, establishing a new standard of care for patients. We also highlight the exciting treatment options with tarlatamab, the DLL3 bispecific T-cell engager with a novel mechanism of action, engaging DLL3 and CD3 on immune cells to really lead to this tumor lysis and a durable response we're seeing with patients with small cell lung cancer. We know that the Delphi 301 study resulted in an objective response rate of 40%, very exciting. And when patients responded, it was durable. We also see the exciting antibody drug conjugates that have been introduced with novel mechanisms of action, essentially an unassuming antibody providing chemotherapy to the small cell lung cancer, engaging on novel targets on the surface, such as SEZ6, B7H3, and TROP2 that we see and highlight in this paper. When we see response, it's quick and brisk. This is a meaningful opportunity for patients with relapsed small cell lung cancer. And it appears to be durable as well. There's more to learn with management of some of the toxicities, such as myelosuppression or GI upset, but this is a move in the right direction. We also highlight the exciting data from IMforte. This is the role of lurbinectedin plus consolidative immunotherapy with atezolizumab after patients have received induction chemoimmunotherapy for extensive stage small cell lung cancer. We know that the press release shows it in statistically significant improvement in overall survival and progression-free survival. Hoping to see that data soon. This is really hoping to reshape the treatment landscape for patients who have received chemoimmunotherapy. Is there a role of maintenance lurbinectedin and moving that therapy earlier in the setting for patients who are receiving chemoimmunotherapy? There are so many new trials that are coming up and coming down the pipeline for small cell lung cancer. One study I'm really excited about is the SWOG Cooperative Group Study, PRISM, which we highlight, which is S2409, should be launching soon. This is a biomarker subtype-driven study. Patients will receive induction chemoimmunotherapy, and based on subtyping, which is done on immunohistochemistry, as well as looking at SLFN11 status, we will be able to tailor therapy based on those biomarkers, whether they have ASCL1, NeuroD1, PALCHF3, or if they have SLFN11 positivity or negativity. We invite you to check out our new paper in Cancer, the top advances of the year for small cell lung cancer. If you're as excited about these advances as we are, we really encourage you to check out our paper